Our viewers, welcome to this special edition of the Wakwetu TV. Wherever you're watching us all over the world, welcome once again um, to this special edition of Wakwetu TV. The program is called One on One with Dr. Kasonso. This is a program where we discuss economic development with emphasis on Zambia. Last week, we started on a program of economic development through digital innovation. That was part one. And then today, we are moving to part two of economic development through digital healthcare system. And on Friday, we'll be moving forward to talk about digital healthcare system in Africa. Today, we've got our special guest, and just a preview or a preamble. The reason why we've got our guest today and tomorrow is because of what is happening in our country, mostly, government ministries and more specific Ministry of Health. There are a lot of issues happening at Ministry of Health. Drugs are stolen, staff don't go to work, or they go to work and run away. So at Makwetu TV, we don't just criticize, we also offer solutions. So the programs today and on Friday, they will be trying to offer solutions to what is happening at Ministry of Health, and that can be also tailored to other ministries. And our special guest today, I will, my co-host, Dr. Kasonso, will introduce him, but I just want to mention his name is somebody I respect so much, a patriotic Zambian, a very busy man. He's supposed to be working, but he has come so that we can start talking about solutions to the problems that Ministry of Health has been faced for over 20 years, or even since independence. So we're talking about people who are patriotic. It's what you give to Zambia, not what Zambia should give to you. And this is what this panel is about. So today we've got Dr. Kazhila, who will be talking about digital healthcare system from a practitioner perspective. And then on Friday, we're gonna go further and talk about digital health in Africa with from an IT perspective. And our guest will be Mr. Sidin Gondwe, who is based in Lusaka. So over to you, Dr. Kasonso. Introduce our guest today. Thank you so much.
We continue today to discuss our topics. On one-on-one, as my colleague has said, we discuss the current issues in business and finance with a focus on Zambia. We continue the journey on economic development through innovation and the adoption of creative technologies in different areas. Last week, we dealt with the mining sector. Today, we come to discuss the healthcare industry in the Republic of Zambia. What we are attempting to do here is provide resources and highlight different areas so that we can have a robust conversation to achieve economic development for our country. And we just don't want to pack the experience, the technical know-how, and the wisdom. We don't want to pack it in the offices overseas or in the offices in Zambia. We want to put it in the airwaves as a resource to the people who are practicing and also to everybody who is involved and every one of us. So today we go to deal with a very important topic. It's the adoption of these creative technologies for the purpose of achieving efficiency and effectiveness in the provision of in service delivery, particularly in healthcare industry. What kind of healthcare technologies can we deal with? What kind of healthcare technologies can we have? And since as my mother's people would say, we don't have wisdom in every area. Today we went and borrowed wisdom. And we bring to you today Dr. Kazhila, Bankambo Bakawande, is a Zambian cardiologist and an internal medicine specialist with more than 25 years of clinical experience in Zambia, South Africa, and Canada. So when we call him a global practitioner is because he prides a trade beyond a country and beyond a continent. He is currently based in Canada, where he has been for the last 21 years. Dr. Kazhila is a graduate from the University of Zambia, the School of Medicine. He did his residence in both internal medicine and cardiology at the Nelson Mandela School of Medicine in Durban, South Africa, now called in those days it was called the University of Natal School of Medicine. He holds 2 fellowships in internal medicine from South Africa and Canada, and a certificate in cardiology from South Africa, respectively. He has previously held positions as a chief of medicine and chief of clinical care at the Ross Memorial Hospital, and also previously served on its foundation board. Dr. Kazhila runs a private practice in the city of Kawatha Lakes, and he co-runs a K2 Canadian Care Echo Lab, a state-of-the-art cardiac investigation lab, which he co-founded. In addition, he co-directs 2 hospitals-based echocardiography laboratory. Dr. Kazhila is a staunch Africanist. He is the former founder president of the Global Alliance of Zambia Healthcare Professionals, and not-for-profit registered in the state of Delaware, and it sits on the board of directors. He is currently the global director for healthcare for the US-based not-for-profit Africa Diaspora Development Institute, ADDI. He is involved in a number of startup companies, including Mountain Crest Group, a Canadian-based investment company targeted at investing in Southern Africa, particularly Zambia, and he is a current interim board chairman for another startup, Africa Diaspora Health Services Corporation, ADHS. Dr. Kazhila is a married man to his wife, Lorraine, who is a registered nurse, and he has 3 children, Mapesho, Luyando, and Wazwama. So we are bringing to you an expert in his field to discuss with us the adoption of technology in the healthcare industry in Zambia and how we can improve conditions in our country. Join me as we welcome Dr. Kazhila to One-on-One on TV Bakwetu. Dr. Kazhila Nkambo, moyai.
Nkambo na asante vingi pakuituva kuintroduce. I'm so humbled and privileged to be here. I would like to make a disclaimer before we continue that I didn't have much sleep this morning. Had to be up at about 3 a.m. our time, because that was the time we're handing over the equipment to UTH, where the Minister of Health, Ms. Sylvia Masebo, was receiving. So I had to stay on till early hours of the morning and then go to work and then finish my schedule and come rush here to be here. So pardon me if I'm a little bit groggy, or it's part of what I do. But thank you so much, Kambo, for that introduction. Inemwamba tuburongo, mukika ondete ba twambamba, twasanta vingi mwane. And so, yeah, thank you.
Kiawama, panopo mwaya Nkambo, Bachilufya. Have you packaged the question for my relative?
Yes, I do. Kazhila will put you on the spotlight there now.
Put him to work. Put him to work.
Yeah, we'll start. But Dr. Kazhila, what you do, I cannot do it. But you've got the grace, I know. And thank you so much for what you do for Mother Zambia. And continue doing it, and God will bless you. Let's go into the questions. My first question, Dr. Kazhila, is let me just go to my first question, Kazhila. What is digital healthcare?
Right. Yes, digital health. So again, I would like to mention that I'm a clinician. I'm a clinician, and I cannot sit here and pretend to be a digital a healthcare expert. But what I'm bringing is experience of actually working with these things and having the ability to see that these things really help healthcare delivery in practical terms. So not just in theory. And before I answer the question you asked about digital health, maybe let me give also a little background to why we're even here and why Van Cambo and yourself, like Chilufya, I'll call you Chilufya throughout the, because in Kaonde we don't have chi.
Yes, yes.
Yeah, the
Kafamo.
background is that I had seen the Honorable Minister of Health, Silva Masebo, doing a tour of level 1 hospital in Matero. And it was an impromptu visit, and she was inspecting and interviewing staff, interviewing patients. Credit to her, fantastic job. But what I couldn't help seeing or noticing is that a lot of the issues that were a challenge are some of these issues that we can solve using digital solutions. And so I think when Van Cambo saw that, he said, hey, you're talking about this proposition of coming up with a policy on digital platforms in Zambia. Why don't you come and join us here? So that's why I'm here. Now, to answer your question about digital health, what's digital health? As the two words imply, you're literally trying to use digital solutions in healthcare delivery, in simple terms. And the other term we use for that is e-health. You know, nowadays, everything means electronic, right? So E stands for electronic health, same thing as digital health. You got e-government, which many African countries are trying to look at so that they digitize the entire government operating system, and so on. So that's what digital health is. Now, to help answer that question, what you might ask me, what examples are you talking about when you talk about digital health? So some of the simple examples of that are things like the use of mobile phones to talk to patients. That's a simple form of digital health. Telehealth, more advanced, telehealth and telemedicine. Telehealth is all encompassing. Telemedicine more specific to the practice of medicine using tele systems. And then you have much more emerging technologies like artificial intelligence and machine learning. You have things like blockchain technology, which we'll talk about later down the line, because that's what Sydney Gondwe will be focusing as well on. You talk about Internet of Things, where devices are able to synchronize and talk to each other to make the work of the practitioner easy. And you've got other things like, virtual sort of platforms which help enhance, augment the perceptions. And we have robotics. Robotic surgery now has got a foothold in surgery, and it's being utilized in the Western world. And maybe only South Africa is the only country that utilizes robotic surgery. Then you have things like drone technology. We know that Rwanda, for example, they're using drone technology to deliver medicines and blood, to remote parts of the country that are not accessible. So that's sort of in a nutshell what we're talking about when we talk about digital health. So what we're saying here is we need to start tapping on these technologies to make it easier to develop a system that will deliver universal healthcare to our people, true universal healthcare.
Kazhila, that was fantastic. Before I go to my next question, you mentioned about Rwanda using drones. In Zambia, it looks like healthcare quality is not the same in Shangombo or Chinsali or Kabompo as in Lusaka. A lot of people have to go to Lusaka to get the best healthcare system. Do you think e-health can equalize, the healthcare system throughout Zambia, or can offer
Absolutely.
solutions?
If you say can, yes, absolutely. If it were possible for us to be able to connect the entire country with fiber optics, broadband, and make internet available reliably to all parts of the country, deal with the loss of electricity here and there, load sheddings and so on. Yes, it's very possible. But I think to highlight your point, the whole idea of universal healthcare is really to bring quality healthcare to every person close to where they live. Because if I have to go 1,000 kilometers to get treated, that's not good access. That's not affordable, first of all, because all gas prices are up. So for a person to travel that far, it's going to cost them. So it's not affordable, and it's not accessible when you do that. So yes, I think we should be aiming at bringing quality healthcare to the people in Shangombo, in Kasempa, in Kaoma, and on that one, I would say one of the low-lying fruit that we can tap on is telehealth, because with telehealth you can actually be in a remote place. I could be in Canada and I'm reporting on the MRI that was done at Mainasoko just 2 minutes ago, and deliver that report to the doctor, and the doctor can then act on it. But what's happening right now is Mainasoko doesn't have enough radiologists, so they have a Chinese guy who comes twice a week and then reads some, then he has to go on site. What we're saying is you don't have to be there to participate. It's like I'm here in Canada, you are there in UK, and my brother Dr Kasonso is in the States, and we're talking to our friends in Zambia. We are just saying these platforms are available. Why not apply them in healthcare?
Kazhila, you've said something very important. During COVID,
Yes. Mm-hmm. Yes.
we worked just like normal because of electronics.
Yeah.
I've been working since COVID. I've worked at home more than in the office because
Yeah.
we've got fast internet, broadband. You can sit anywhere as long as there's internet. I can go and work from Zambia the whole year without coming to the office. So that's
Yeah. Yeah.
fantastic. Over to you, Kasonso.
Doctor,
The next question that was the
yeah,
first question. The next question to Dr. Kazhila.
yeah, Dr. Kasha, you have characterized for us the use of digital technologies in the healthcare industries in Zambia, past, present, and future. Recently, government uncovered thousands of ghost workers, and you suggested that digitalization could have prevented the Ministry of Health from hosting ghost workers in their payroll system. Please demonstrate how, to our listeners, how the adoption of creative new technologies could improve healthcare services delivery in Zambia, and how that the digital technologies could have prevented the hosting of ghost workers in the Ministry of Health.
Thank you very much, Dr. Kasonso, for that question. Indeed, that issue of ghost workers and other problems such as fake drugs, the issue of fake drugs, the issue of unqualified staff being in positions can be sorted out using digital means. The thing is that if we had a platform in Zambia where we digitize the entry of particular workers into a particular workspace, we would be able to capture that data and put it to a central repository where we can actually map out to see who's working where, and therefore there will be no need for people to pretend that there's a hospital in Shangombo when there's no hospital, because we will be able to discover those anomalies much quicker than me as PS jumping in a truck and driving 800 kilometers to check for myself. And also we have Google. I joked the other day that we have Google Map. It can show you if there's a building or not, if there are some fake buildings. But ghost workers definitely. Also the idea of blockchain technology, which Sydney will expand on because he's an expert, helps improve efficiency, but also prevents fraud. Okay, that's one of the things with the blockchain technology, because you create these ledgers of data that are interlinked through a chain, and those chains are independent and separate, and so you are decentralizing the system so that you can know what's happening in Shangombo and what's happening in Lusaka. And also they're incorruptible. Nobody can just jump in and change a password and then pretend, because there's a security to it. So the other thing is, today, for example, there was a pilot project in Uganda that looked at fake drugs. You can track fake drugs and know their source, where they were bought from, using technology. So all these different problems we're facing can be sorted out by the use of digital means. I mean, I'm not saying they are 100% foolproof. Certainly we'll discuss some of the difficulties that Africa would face in order to implement such things. But I think that's how I'd answer your question, Mwisho.
So on that, Nkambo, what you're telling us that if we digitalize, we stop looking like geniuses when we find problems in the Ministry of Health or in the healthcare industry. So then what are the emerging digital health solutions that are currently available?
All right. So currently what we have is, for example, we do have blockchain technologies emerging very, very well. But that one, obviously, there's a paucity in terms of skill and capacity building. But certainly, I would say one of the solutions we have accessible is electronic medical records. Here in Canada, we digitized the system way back in maybe 15 years ago, so that I don't use paper anymore. Everything I enter into electronic records. I use Dragon to dictate my notes, and all that stuff goes into the digital system, and therefore it makes my workflow much easier. It also has there are safety issues that come in with drug prescriptions. When you prescribe a drug, there are warnings that tell you about drug-to-drug interactions. One thing we doctors know or should know is that if I prescribe amlodipine and I prescribe another drug, there may be potential interactions there which are not compatible. And it's the pharmacist who, using technology, they have a whole algorithm warning system that's it. She gives them a red light saying, hey, doc, that's not a good drug to prescribe because he's on this. Now imagine that little pharmacy across the road in Matero, where patients are given prescription and they go to the Indian guy. Doesn't even care about interactions, probably just gives, oh, hey, here's your drug, you know. So telehealth, electronic medical records, that's EHR, is one of solutions that are available. Telehealth is available, like I said, and nowadays we have wearables. So patient can be far in Shangombo, and you can hook onto a gadget on him that links up to the whole digital system, and I I can read blood pressures. I can even listen to the heart using some. All I need is just somebody there with the patient to hook these things up. And I tell you, I can make a very clear and good diagnosis without me sitting face to face. So those are some of the examples. And also e-learning. E-learning is an important part of the healthcare system because we need to teach each other. So using electronic methods, we can use virtual conferencing and so on, which we are using even now to teach. And I'm proud that Gaza, for example, has initiated a CPR training program. CPR stands for cardiopulmonary resuscitation. What we noticed is people are dying in accidents in Zambia because the public don't know how to deal with an emergency. They just grab people, dump them in the back of a truck, and drive to the hospital. By the time the patient arrives, they're dead. They could have been left where the accident is, and all the bystanders could have done is just make sure the guy's breathing. If there's bleeding, control the bleeding and wait for help, and that patient could survive. Or you could cause spinal injuries if you just lift somebody anyhow. So these are the things Gaza is doing. And they're doing it remotely from Canada, from the US, connecting with our brothers and sisters on the ground and learning together. So that's one example of e-learning. But I mean, I could go on and on. There are many examples.
Dr. Kazhila, that's fantastic. Now, Dr. Kazhila, what effects do you expect these digital health solutions to have in healthcare in general?
Okay, so the effects are, one, efficiency. I think in Kasonso's opening remarks, he talked about efficiency. So digital solutions improve efficiency. What do I mean? It means the speed at which I work is improved, the accuracy of my quality of work improves. So I will avoid misdiagnosis because of inaccuracies. And then also the cost in the long term is going to be reduced because you are going to avoid unnecessary waste and unnecessary bottlenecks. You're also going to, I think ultimately, when we talk about benefits in healthcare, our main endpoint is to see to it that the patient has received the care that they deserve. And so digital technologies will help reduce mortality. It will help reduce morbidity, and it will also give the patient a better sense of well-being, of being looked after. And I would say that there are pilot projects across Africa that have looked at using digital solutions in, for example, the management of HIV/AIDS. There have been solutions in TB diagnosis using certain kits. There have been solutions in even diagnosing cancer, early cancer, using digital means. So all these are the benefits that we would accrue to the patient.
Yeah, and then Kambo, when we are you said that we benefit efficiency in the delivery of the services. So it means that these new technologies help us to achieve the efficiency in the delivery of that service. And what are some other practical solutions that the digital health, what are some of the practical solutions that digital health offers in healthcare?
Yes, absolutely. Like I said, mentioned some of those solutions in my earlier statement. For example, in Tanzania, they did digital ultrasound using telemedicine solutions, and it showed some benefit. In Malawi and Uganda, they're using smartphone, cloud-enabled portable ECG machines to diagnose heart problems. But here's the problem, Mkambo and Chilufya, is these pilot projects that are targeting digital technology and digital solutions have been sponsored by organizations like WHO and other, developed countries. But the problem is the results are not being taken up by governments to now use that data, that information to now start creating policies to digitizing their healthcare system. In Uganda, for example, they put a moratorium on all these pilot projects because they were fighting each other. There was so much chaos. These ones are doing a little pilot here, pilot there. So what we need is a more generalized, holistic system. And I'll tell you what, the Rwandans, I always go back to Rwanda, and I'm glad Paul Kagame came to meet our president the other day. The Rwandans started planning for their digitizing their healthcare system and government as a whole as early as 2000. They created this program and policy called NIKI 1, NIKI 2 in phases, in a phased approach. And so they've been building up slowly. And right now, Rwanda is targeted to probably be among the first African countries that will have e-governance, everything electronic. So what we are saying here, and I hope if anybody can take anything as take-home messages, our government needs to start now, to start creating a policy on digitizing Zambia's healthcare system. And if there is a policy already, we want to see implementation of the policy. We want to see government articulating about it, letting the public know. Because one of the major problems is uptake of digital technology. If the public do not know, they will not use. If technology scares them, then even if you spend millions of dollars, they won't use it. So there is an education component, and we need to start now. And one of the advantages we have in Africa is that 60% of the population are young people. And young people, their uptake of technology is much, much quicker than you and I. So we have an advantage. We just have to tap on it. And I'm saying we should use our very young people to actually create these digital platforms. We don't have to look up to India and so on. We have enough high IQ Zambians. All they need is a platform, and you'll be surprised on what they can do.
But Dr. Kazhila, that was fantastic. Before I go to the next question, somebody was telling me, I met a doctor here who used to go and work in Africa, Tanzania, Zambia, and was telling me that Zambia, African countries, they've got very good well-educated doctors and in government, especially Ministry of Health, experts there, and some of them are even sent abroad to go and do policy, studies in policy on healthcare. So you might find that they've even done that, but it's been packed. Somebody is saying there's no money, or they're just delaying. So if the issue is money, what my question is, what are some of the reasons you think digital solutions should be adopted in Africa? No.
Well,
sorry. Can implementation of this digital solution save money in the long term? Because they say the issue is money, but if the investment is expensive, but the benefits are high in the long term, why shouldn't we do it? So the question is, can implementation of this digital solution save money in the long term?
The quick answer to that question is absolutely, absolutely. I mean, the reason why the developed world is catching on, digitizing everything is that when you increase effectiveness and you increase efficiency, you are saving money. Because, like we've been bemoaning all this time, I felt for the Minister Masebo when she was so frustrated, and rightly so. There's loss of money through pilfering of drugs, as she said, man hours not being checked. For example, the pharmacist who was disappeared, and one of the volunteers was lying for him that or her that he's sick, and maybe has gone out to a private entity somewhere to work during working hours when he should be in UT. All those could be saved by digitizing. Just we were talking the other day about Chilufya, that out here in the West, in Canada, in the UK, you have tags that are electronic, and they can show when you arrive at work, and they can show when you leave. And so we can track you, your man hours, where you're spending your time without us coming physically to look for you. That's saving money. We can save money by tracking fake drugs, because the patient who gets that prescription from that Indian guy and gets an expired drug or a fake drug and doesn't get better and has a stroke and gets admitted because his hypertension wasn't treated, will cost the government more money to look after a stroke patient. So that is one way we could say, but also just purely efficient way of running the whole ministry, it would help. Now, one of the problems is that, actually, just listen to some data here. So 95% of the world's population now live in areas that are served by mobile networks, 95% of the world. And over 7 billion mobile subscriptions are done globally, which means it's an average of one phone per person. But when you now tease Africa out of those statistics, you find that mobile penetration in Africa is at 74%. And then the internet penetration in Africa is only 22%, about 21.8. And so that poses a challenge, because we are not spending money in laying out the fiber optics, laying out the broadband, so that we can reap the benefits and save money. So we're going to keep contending with the same issues that when I was a first-year student, or when I was leaving UTH, the same problems that the minister was complaining about is what I used to see then, and this is now over 30 years ago, and maybe worse. So we cannot allow a situation to go on like that. I think we have no choice. Let me put it this way. We have no choice but to spend the money now and reap the benefits in future. As a matter of fact, there are short-term benefits, medium and long-term benefits. So even if you implement today, you'll find that there will be benefits in the short term. The moment you implement the digital solution, you start seeing the result right there and then.
You know, before Dr Kasonso comes in, Kazhila, we talked about ghost workers, and here in the UK, I work for NHS. You know, one of the largest healthcare. Everything is Now, Kazhila, I'm an accountant. You know, I'm a finance manager supporting clinicians like you. And the team that I support, we support about 5,000 workers, as 5,000 workers. So that's the payroll. Kazhila, not even one day we'll find a ghost worker because of the electronic system. You know what happens?
Yeah.
Every worker is assigned to a cost center. And every worker is also assigned to a subjective code, which is an account code.
Yeah.
And there is a budget holder. So somebody looks at even if somebody has been overpaid, or there is a payment that somebody doesn't know, somebody will pick it up. because there's a budget holder who controls the budget.
Yeah.
So who controls that person? So when a job has to be advertised, like what happened at UTH, the manager of that person who has got a cost center and a subjective talks to HR electronically. All this is done electronically.
Yeah.
We want to put a job on the website. It's called NHS Jobs. Electronically again. And then it says, have you got a budget? Yes. Okay. HR looks at the job descriptions, everything. And then HR says, we're going to put a job on the track. But before this job goes live, we want the accountant to approve it.
Yeah. Yeah.
And
So
all that is done electronically. And it comes to me, Kazhila, if I don't approve that job, because what will happen is I'll look at, is there a budget? And is that job being approved by the manager? Is that job being approved by HR? And then once I approve, it goes live.
Yeah. So
and then Kazhila, I'll tell you one example. Today, we discovered that one of the workers was double paid. You know how we discovered? Budget holder meeting. How come your budget in your team is overspent or over established? And we discover one employee was paid because all that is electronic system. Over to you, Kasonso.
Thank you. What Chilufya is describing is trying to say that when we digitalize and we have an electronic system of operating the healthcare system, there is going to be embedded into that internal controls. And internal controls is the hallmark of efficiency in terms of our operations. Now, Dr. Kazhila, can the Ministry of Health manage to implement these solutions alone?
The answer is an absolute no. Even if they wanted to, they would not be able to, because you need to have other players in order to implement a digital solution. So the first player that I will talk about is the Ministry of Technology. So these two ministries have to meet, marry, and start doing things together, to planning and how would we implement this. So maybe budget can come to technology and to money Ministry of Health. They put together, start with, bring a few Sydney Gondways to give you the ideas, start something. So that's number one, is the Ministry of Technology has to be involved. Number two, we need PPPs, private-public partnerships. So we need to bring in the private sector. In many countries that have been successful in implementing digital solutions, they brought in private sector, because that's where innovation comes from. That's where, they have the money to spend. So private sector is key. And so people should not start getting scared. No, if we pay this company, this boy will be millionaire. So let's try to cut him down. No. Let the boy be the millionaire if he has the knowledge. In the end, you all benefit. So let's forget about that. What else? So private-public partnership, and also even I think the East Africans tend to be, I've just been observing, you correct me if I'm wrong, but East Africa seems to be very cohesive when they do planning. Countries tap on each other, so they
Kenya, Burundi, Tanzania.
Yes, Tanzania, Uganda, Kenya. They even created a whole network among their countries called Reach something. And that seems to help. It helps, you can learn a few things from that. Maybe combining all your IT brains in the East Africa will help implement this thing. But if Zambia is doing its own alone, Zimbabwe alone, South Africa doesn't even care, they're chasing at Makwere and the foreigners should leave the country, then we're not on the right track. So we need intergovernmental partnerships as well. Yeah, just to name a few of our Kasonso.
So what you are saying is that there are countries in Africa that have adopted these technologies, and we can benchmark our practices against them.
Yes, I think
Okay. Over to you,
there are
Patrick.
some who are way ahead. If you do a Google search by Kasonso on digital health, you see Zambia does not appear anywhere.
Yes,
Malawi
I
doesn't appear
did.
even
I
more.
did. I did. I did.
Did you see the same, or maybe I just
Yes, I
missed
did
it?
the same. I was shocked. Oh, I was shocked how Kenya. I never expected Kenya was so advanced.
Yeah.
Kenya, Burundi, Tanzania is following suit.
Rwanda.
Rwanda, yeah, not Burundi, Rwanda. It's unbelievable. Rwanda are using drones now to deliver medication to the
Yeah.
rural areas.
And blood. And blood.
And blood.
Yeah.
That's fantastic. Now, Kazhila, if Zambia are to adopt a digital health strategy to improve health service delivery, what tools are currently available?
Yes, indeed. That's a good question, because I think we all talk about this should be done, and we talk in terms of theories, and yet when the practicality comes up, we fall short. And I think in this case, there is evidence that there are toolkits available for governments that the WHO, along with another organization, an NGO that looks at it's called International Telecommunication Union. They've come up with some national e-health toolkits. And these toolkits look at digital health priorities. It helps governments set up visions and plans of action in terms of delivery, monitoring, and evaluation of the attainment of their vision. They also, these toolkits articulate the required enabling environment, such as standards that are required, and importantly, legislation, okay? Because all these things we're talking about, if they're not properly regulated, then we can run into trouble. So legislation has to be in place. For example, to say that you can, Dr. Kazhila can read an MRI in Zambia when he lives in Canada, or maybe closer to home, just, who is allowed to go into this space and who isn't. And also they provide appropriate technical service delivery solutions. And they also provide financial and human resource to help governments implement them. So we are saying that, look, Zambia, toolkits are there. Maybe if we had one of the officials at the ministry, who is in charge, they will tell us if they have looked at those toolkits and whether they're helpful or not.
Mr. Saliki, do you have a question for Dr. Kazhila this evening?
Good. Yes, of course. Good evening.
Yes,
Doctor.
Frank.
Yeah, moja iktivi vakwete tata.
Twasanta mwisho, twasanta M1.
So for me, my background obviously is human resources, and I've also done clinical governance. So when I hear some of the stories, it really, I think, what is everyone doing in terms of digitization? So with my experience, in terms of we can know how much medication is in the hospital at the time. You can wake up, this is the amount of medication that has gone on. Is that correct? Do you think if we had that kind of technology in our country, then that will stop our doctors, our surgeons going to do surgeries and then running out of medication halfway through the surgery?
Yeah. That's correct. Absolutely. And Frank, talking about you who's in the governance side of healthcare, I'll say this, it might not be popular and I might be crucified for it by my fellow doctors. But listen, gentlemen and ladies, doctors, we are not trained to be managers or administrators. If you're a medical doctor, you're trained to look after the patient. And there's this tendency in Zambia over the years where a guy graduates from the medical school, goes to a rural area for a few years, and there he's already the head of everything. He comes, he's appointed into level 1 as the superintendent and all that. I feel we are misusing our doctors. We have shortage of doctors. Why don't we let them stay in the wards? Let them stay with the patients, and then bring in hospital administrators like Frank, who are trained in hospital administration, because that's the only way you'll be able to streamline things and have somebody who's looking at things holistically and able to detect problems, things like budgeting, finance, all that. I know there are finance people, but you need somebody who can guide all these players to do a better job. So the only exceptions are those doctors that have gone for further training in hospital administration, and they love that. That's no problem. And I would suggest we restructure the whole system of how we appoint administrators. Let doctors become chiefs of staff of hospitals. A chief of staff is just looking at managing the staff, the doctors, managing that and making sure there's every doctor where they're needed. And then let administrators deal with supervising the pharmacist, supervising going to the lab. He's wasting his time going to the lab when he should be seeing patients and clearing the crowd. So anyway, that's the point I wanted to make, and I'm looking forward to seeing those kind of changes in Zambia.
Just to give you an example on your explanation there. So in my previous role, what used to come in the morning is I used to come in and I have to make sure, have we got the medication that is needed? I used to work in ophthalmology. So for eye surgery that there is, have we got the medication that is needed? And I had to observe of what happens when patients go into to have their operation. So it's a case of somebody came in to have their injection in one eye and got it in the other. So I sit there, all the medical people are panicking. I sit down and go, actually, I'm going to make a plan for you. This is what you do. These are the steps you follow. When you go in to do operation, let's treat it like a theater, like everyone, tick that, tick that, tick that. We came up with simplest of solutions. Literally, all I said was, so when somebody's having an injection on the left eye, let's put a mark on the left eye. It was that simple. It was that simple. And I think it doesn't have to be complicated. And when something is digitized as well, that it just helps it, because I could see it live to say that medication has been used. So we are one less there. We're one less there. We're one less there. And I can press another button to go, we're one less, and an order is in. And never do you ever run out of medication, because you can do it as it happens live. But then there's something that is important in all of this. How can the rural areas, with the lack of equipment, because this needs equipment, this needs proper working equipment in every hospital, how can the rural areas become successful using technology when we don't have that technology at the moment?
Definitely. I think that is one of the problems that Africa has, is that there's a very clear divide between like what I think it was Chilufya said, Lusaka versus say Shangombo, differences like night and day. So I think there has to be a deliberate policy by government to try and bridge that gap if they hope to bring universal health care to all citizens in the country. We need to start spreading out the resources to the remotest part. And I think that's where the new Dawn administration, so far we've stayed away from politics. but let me give them a tap on that, sort of kudos, is that they are trying to decentralize and bring the money to where the people are. Maybe if there are some people there who think, hey, we need to use some of this money to lay some, to improve our broadband, and so that we can have access to, then that would be money well used. But it's a problem everywhere. Problem is large stretches of land, isolated. The landscape can be very difficult to implement these digital solutions. And of course, financial constraints are a challenge. But all we are saying here is that let's start somewhere. Let's not, we're playing advocates here. We're just trying to keep pushing this point that in 10 years' time, we don't want to see another Minister of Health walking around and saying the same thing. That's basically what we're saying.
Yeah, well, nkambo bakachira twasanta vingi kuyera kuitwambisha hapo on the adoption of new technologies to improve service delivery in the area of healthcare. And you have rightly wrapped it up nicely by invoking the issue of government policy and what government is doing, and how that can be taken advantage of by our people to try and implement some of these solutions, taking blockchain technology to help deliver better healthcare services across the country. So do you have any closing remarks as we are coming to the close of the show tonight?
No, I must just say that I'm really appreciative of this privilege and honor to be on this wonderful platform, TV Vakwetu. And I love the fact that it's called Vakwetu, because in Kaonde, Vakwetu means friends. And it shows that we are all friends. We are friends here on the platform, and friends with our brothers and sisters in Zambia. And we are all trying to find solution for our beautiful country. We're not here to show that we are smarter or, whatever it is. So I appreciate that. And the message is, let's keep talking about these things. And then let the powers be take the action. Thank you.
Over to you, Chilufya.
Chilufya has disappeared on us.
Yeah. Thank you so much, Dr. Kazhila, for coming. We know that you're tired. You've been working since morning. We do appreciate the work you're doing. Frank, thank you so much for joining us and for the good questions. Dr. Kasonso, thank you so much for co-hosting with me today.
Yes.
And to our viewers, thank you so much for your viewership. Dr. Kazhila, that was a fantastic program. You illustrated all the issues very well. And I think the one point I wanted to pick up from what you said is, for how long are we going to see ministers going to ministries to go and check if workers are going to work, medication is stolen? So, SATA used to do that. Banamasewa is doing that. Why can't we implement a digital system and stop some of this pilfering, ghost stuff, and so many other issues? Thank you so much. Dr. Kasonso, your closing remarks before we close, and you can close the program. Over to you.
Yeah, thank you, our viewers, for seeing us today. We brought to you a show on part 3 of the adoption of new technologies to improve the conditions of living in our country. And today our focus was healthcare. And we brought to you Dr. Kazhila, a global cardiologist and an expert and specialist in his field. And you can go over this show and watch it multiple times to hear the suggestions and to hear the proposals that we have made in different ways that we can improve service delivery in the healthcare. We are improving the business of the people. We continue on. We are bringing Mr. Gondwe to come and give us the direct application of what Dr. Kazhila has taught us, has shared with us today. And then we are going on to the industry of agriculture. We are bringing an expert in that field again. And again, our focus is bringing in new technologies to innovate and improve our conditions. Remember, this is one-on-one with Dr. Kasonso, and share this show and share this program. We come here to entertain, sometimes to mostly to educate. And we are very excited that you are a part of our group and you follow this program and share it, and also contribute to support this program so that we can continue bringing these types of programs and explaining these conditions to everyone, and getting information that is so necessary for our country to move forward, for our government to have data, and for the conversation to keep happening on the conditions. So thank you for seeing us today, and we will see you next time. Have a beautiful night there in the Zambia, and have a good afternoon in the Americas, and have a beautiful night in the Europe. And thank you for seeing us today.
Before we close, thank you so much, Kasonso. On Friday, Kasonso mentioned about Sidney Gondwe. On Friday, at the same time, we've got Sidney Gondwe. Sidney Gondwe, this will be a follow-up program. He's going to talk about digital healthcare in Africa from an IT perspective. Please don't miss it. And then, Frank, have you got anything to say before we close? Any closing remarks?
I think it was a very, very important topic. I think it's important to know that things can get better, and digitizing our healthcare system is a way to go. One is for quick diagnosis. Two, it stops people stealing. We can track people who sell fake drugs, as Dr. Kazhila said. We can drug them a lot quicker. It makes things very quicker and so efficient, and it helps us go back and track. And for us to have accurate data in making decisions of what we need to do for our health system, we need to have information that we can tap into very quickly, and digitizing our economy is the right way to go. And just before we hand back to Patrick, just don't forget as well, we've got our usual program. We got our Dr. Munsha. I forgot his name. Got Dr. tomorrow night. I'm done. It was nice knowing you, everyone. We got Dr. Munsha on tomorrow, and our usual Wednesday program. Also Wednesday 22 hours Zambian time. You've got me on Thursday at 21 hours with Thursday night motivation with Frank. And as we head, we've got another program on Friday to carry on the digitization of the Zambian healthcare.
Thank you so much, Mr. Saliki. Once again, Dr. Kazhila, thank you so much, Dr. Kasonso, and our viewers. May the good Lord bless our beloved mother Zambia. Good night and bye for now.
Good night, guys.